Welcome to the International Translation Health Store. Today we are in Hong Kong, China, and we translate this blog post from Chinese to English. Today topic: gynecological examination. Will uterine polyps affect menstruation and even make it difficult to get pregnant? Regular physical examinations can prevent the progression to cancer, so let's hear from Teresa from the International Translation Health Store.
Thank Richard. Today on the International Translation Health Store. Today we are in China discussing the topic uterine polyps and what the effects it has on the woman reproductive system. Let's find out from Hong Kong doctors. Gynecological examination. Will uterine polyps affect menstruation and even make it difficult to get pregnant? Regular physical examinations can prevent the progression to cancer. Changes in menstruation are a physical signal for women to pay attention to uterine health. When a sudden increase in menstrual flow is found, it is often an early sign of uterine-related diseases. One of the common causes is uterine polyps. Uterine polyps are originally a type of benign tumor, but they can affect fertility. What are the symptoms of uterine polyps? And how can ladies find out? What are uterine polyps? Uterine polyps are benign tumors caused by the excessive growth of endometrial cells. These cells are originally located in the innermost layer of the endometrium, which is the cell layer that is peeled off during menstruation and the embryo develops during pregnancy. The number and size of polyps vary from person to person, ranging from several centimeters to less than half a centimeter in size, can also appear in women before or after menopause. The cause of endometrial polyps in most patients is unknown, and a small number are related to excess estrogen. Obesity is usually the cause of excessive estrogen. In addition, some of the reasons are those who have polycystic ovary and breast cancer survivors. They need to take hormonal drugs after surgery to control the disease, and these drugs will increase the endometrium. Changes, including the development of polyps or cancer. Symptoms of uterine polyps: sudden increase in menstruation, sudden extension of menstrual period, abnormal vaginal bleeding during non-menstrual periods. Polyps may develop into cancer and require regular gynecological examinations to track them. Although polyps are a type of benign tumor and do not suddenly grow in size, shrink or shift, many women with uterine polyps ignore the possibility that polyps may turn into cancer and ignore them. Because uterine polyps are located in the inner cavity, the uterus keeps contracting because it thinks there is a foreign object that wants to be expelled, so it can cause pain. In addition, uterine polyps can also cause problems such as continued bleeding after menstruation, bleeding after sexual intercourse, or abnormally heavy menstrual flow. In addition, the appearance of polyps can make the surface of the inner cavity uneven, thereby hindering the implantation of the embryo, affecting the chance of pregnancy. Some women have not been able to conceive for a long time, and only after undergoing infertility examination did they learn that there were many polyps in the uterus. If the polyps are not removed, they may continue to affect menstrual periods such as menstrual pain, abnormal irregular bleeding, etc. Ignoring the changes in polyps in patients will bring potential health risks, because about 0.5% to 4.8% of polyps will deteriorate into cancer. As the age increases, the chance of developing endometrial cancer becomes higher. Since polyps are located inside the uterus, they cannot be detected by physical sensation or naked eyes. They can only be discovered through ultrasound examination. Since there are no obvious symptoms, women should have regular gynecological examinations. If they notice abnormal menstruation, they should seek medical advice as soon as possible. Patients with cervical polyps generally have no obvious symptoms, so they usually only discover small fleshy particles on the cervix during a gynecological examination. At most, patients will experience intermittent bleeding from the incisional tract, or a small amount of bleeding after sexual intercourse. Since polyps are mostly benign, they generally do not cause cancer. However, to ensure safety, it is also recommended that women undergo regular gynecological examinations and have polyps removed as soon as possible after discovery. Meet. If you have had sexual experience, vaginal ultrasound is generally used as the examination. Since it is a routine physical examination, many clinics on the market can provide professional health examinations for women. Women only need to clear their urine and relax as much as possible before the examination. The doctor will. The slender probe is inserted deep into the vagina to obtain precise images of the uterus and ovaries at close range. Depending on the situation, the doctor will inject saline into the uterus to expand the uterine cavity so that the examination can be more careful. The process is generally painless. After the menstrual blood is drained, it is the best time to conduct an ultrasound examination. Because the endometrium is thin, small polyps are easier to detect. Ultrasound scanning examination uses high-frequency sound waves to pass through the human skin, displaying various organs and tissues of the body as real-time images, thereby observing the operation of the organs and the process of blood flowing through blood vessels. Ultrasound scanning is painless and harmless to the human body. No radiation, accurate, reliable and safe. Through examination, the health status of the organs and blood vessels in the body can be known, so that corresponding lifestyle changes can be made or further diagnosis and treatment can be made. Life Young Health, comprehensive annual selected physical examination for men and women. The examination contents include general examination, vision test, blood type, whole blood image, diabetes, hepatitis B test, thyroid function, liver function test, kidney function test, gout, blood fat test, rheumatoid, spine examination, X-ray, urination routine. 01 Online shopping exclusive Hong Kong Body Examination Center Premium Women's Selected Body Examination. Hong Kong Fitness Center is committed to providing the highest quality and professional services. Customer satisfaction is close to 100%, and it has won the trust of customers. We have always provided reliable, high-quality comprehensive physical examination services at reasonable prices. Our physical examination center uses advanced medical imaging equipment and examination facilities, as well as an experienced professional medical team, to provide customers with one-stop high-quality medical diagnosis and laboratory services. With comprehensive health management as the core, we recommend and arrange professional medical and health services for each family member, including physical examinations, vaccinations and specialist medical referrals. Central Specialist Physical Examination Center Women's Basic Concern Physical Examination Program. Central Specialist Physical Examination Center is committed to providing respectable and high-quality physical examination services to people who are concerned about health, and provides a one-stop comprehensive examination. Having a healthy body brings peace of mind. If there are any conditions after the examination, our team of doctors will provide appropriate professional medical advice so that customers can be treated as soon as possible. Lihu Medical Update. Healthy Women Checkup Plan. Update. Healthy Women Checkup Plan. Female menopause is a necessary stage in every woman's life. As hormone levels shift, there can be physical and emotional consequences for women. At this stage, women should pay attention to their health. Our Healthy Women Checkup program is specially designed for women aged 45 to 60 who are experiencing menopausal symptoms to relieve the discomfort and anxiety they face during menopause. This program provides comprehensive screening and advanced imaging services to detect and proactively manage potential health problems before they occur. Comprehensive inspection, health consultation with a doctor, physical examination including blood pressure check and weight index, breast examination, blood analysis, complete blood count, menopausal examination, diabetes, thyroid function, blood lipids, bone health examination, resting electrocardiogram.